Thank you. Mr. President, I believe as Senator Wyden's colloquy comes to the end, Mr. President, I would make a few comments in addition to my colleagues and very much appreciate all of their work. There's
Senator from Michigan.
Thank you very much. There's so many different things to talk about as it relates to how healthcare impacts people. And as Senator Casey said, this is very personal. It's not political. A lot of politics around this, but it is very, very personal. And in Michigan, when we're talking about healthcare, Medicaid alone, we're talking about 650,000 people who've been able to get coverage now, most of them working that in minimum wage jobs, who now are able to get health care that couldn't before, and their children. And that adds to the majority of seniors who are in nursing homes now, folks getting long-term care, folks getting help for Alzheimer's and other challenges, who are relying on Medicaid health care to be able to cover their costs. And I wanted to share a letter as well from Wendy, a pediatric nurse practitioner from Oakland County in Michigan. We've received so many letters. I'm so grateful for that, and emails. But she said, as a pediatric nurse practitioner, I have seen so many of my patients benefit from the Affordable Care Act. Physical exams for the kids are now covered in full with no copays. This means the kids are in to see us, which means we catch healthcare issues and early problems with growth and development that otherwise might be undetected and left untreated until it became a much bigger problem. Isn't that what we all want for our children, to catch things early? Immunizations are covered, which keeps everyone safer. Screening tests are covered, so potential problems are caught while they can still be managed. This better care keeps kids healthier and happier and prevents longer-term costs. She goes on to say, the Medicaid expansion means even more kids are covered, keeping not only those children healthier, but everybody around them healthier. Previously, parents of children who did not have health insurance would not seek care until the children were so ill that they had no other option. Frequently, these children then utilized emergency room care, which, by the way, Mr. President, is the most expensive way to treat health problems. So they frequently used emergency room care, not only a missed opportunity for complete and preventative health care, but at a cost that's passed on to the community, she says. On a much more personal level, in 2015, she says, our granddaughter at age 3 was diagnosed with epilepsy related to a genetic condition, which made her brain form abnormally. On top of the epilepsy, she had developmental delays and autism, all related to her double cortex syndrome. Although our daughter and son-in-law are fully employed, teacher, paramedic, she qualifies for children's special health care under Medicaid. This has been a huge blessing for us, and without it, our family would have been financially devastated. We are hopeful that my granddaughter will continue to have good seizure control and will develop to reach her full potential. But without the care that her private insurance and children's special health care provides, she would not have much of a chance of getting anywhere near her potential. I do not want to even consider how it would affect her and her future if insurance companies can refuse to cover her care due to her pre-existing condition. And she concludes, please do not let partisan politics take precedent over doing what's right and what is best for the health of every U.S. citizen. I know we're all getting hundreds or thousands of letters and emails and phone calls with very similar stories because health care is personal to each of us, our children, our grandchildren, our moms and dads and grandpas and grandmas. It is not political. So I'm very grateful for colleagues being here today, and I want to speak not only about the importance of expansion under Medicaid, but I also want to speak about the person who would be in charge of that a very, very important set of services, and that is the nomination in front of us of Seema Verma to be administrator of the Centers for Medicare and Medicaid Services. This is a critical position, especially given ongoing efforts that we are seeing right now to repeal health care, the Affordable Care Act, and replace it with legislation that would literally rip away coverage for millions of people and pull the thread that unravels our entire healthcare system. So the decisions of the administrator, both as an advisor to the president and as someone with the authority to make large changes to the implementation of existing law, will have far-ranging consequences for all of us, and certainly the people that we represent, and especially for those who need health care, have begun receiving it, and now may very well see it ripped away. In the Finance Committee, when I asked Mrs. Verma about Medicaid, I found that her positions would hurt families in Michigan, would hurt seniors in nursing homes, would hurt children. And looking at her long record as a consultant on Medicaid, we know that Mrs. Verma's proposals limit health care coverage and make it harder to afford health care coverage, putting insurance companies ahead of patients and families once again. I'm also very concerned about her position on maternity coverage. During the hearing, I asked Mrs. Verma whether women should get access to basic prenatal care and maternity care coverage, as the law now allows, and I'm very proud to have authored that provision in the Finance Committee, or whether insurance companies should get to choose whether to provide basic health care coverage for women. I reminded her that before the Affordable Care Act, only 12% of health care plans available to somebody going out to buy private insurance offered maternity care. Majority did not, vast majority. And that the plans that did often charged extra or required waiting periods. Her response indicated that coverage of prenatal and maternity care should be optional. Optional. We as women cannot say our health care is optional. The next CMS administrator should be able to commit to enforcing the law requiring maternity care to be covered and commit to protecting the law going forward for women. Being a woman should not be a pre-existing condition. Getting basic health care should not mean we have to buy riders or extra coverage, because somehow being a woman and the coverage we need is somehow not viewed as basic by the insurance company. We've had that fight. Women won that fight with the Affordable Care Act. We should not go backwards. I followed up with Mrs. Verma along with many colleagues, but have not received a response. Over 100 million Americans count on Medicare and Medicaid. They need a qualified administrator who puts their needs first, and I cannot vote for a nominee who does not guarantee that she will fight for the resources and the health care that the people of Michigan count on and need. And finally, I wish to take a moment, Mr. President, to talk about the health care bill that has now come out of committees in the House and will be voted on in the House and then coming to us in the Senate. Frankly, let me start by saying this is a mess. It's a mess on process, and it is a mess on substance. As a member of the Finance Committee, I can tell you firsthand, this was not rammed through the Senate Finance Committee when we passed the Affordable Care Act. We had months and months and months of hearings, of which I attended every one, I think. And after that, the floor debate and the discussion in the House, and we knew what it would cost before we brought it up, by the way, and it saved a lot of money by doing a better job of managing healthcare costs and creating innovation for our providers. But the truth of the matter is that when you look closely at what is being debated in the House, For families in Michigan and across the country, it's really a triple whammy. Higher costs, less health care coverage, and more taxes. Overall, it means more money out of your pocket as an American citizen, unless you are very wealthy. And it means less health care. This is not a good deal. It cuts taxes for the very wealthy. For insurance companies, gives an opportunity for insurance company execs to get pay increases, and cuts taxes for pharmaceutical companies. Someone making more than $3.7 million a year would save almost $200,000. Let me say that again. Someone making more than $3.7 million a year would put $200,000 more in their pocket as a result of this health care bill, Trump Care. And to put that in perspective, 96% of Michigan taxpayers would not qualify for this. 96% of everybody in Michigan who gets up every day, working hard, going to work, some take a shower before work, some take a shower after work, they're working hard every single day, and they would pay more, while the small percent of those at the very top would get $200,000 back in their pocket. As I indicated, it provides a tax break for insurance company CEOs to get a raise of up to $1 million, but increases taxes and healthcare costs for the majority of Americans. Middle-class Americans, those working to get into the middle class, would see tax increases and lose health care coverage at the same time. Such a deal. For seniors, this would allow insurance companies to hike rates on older Americans by changing the rating system. And AARP, a nonpartisan organization, has indicated that premiums would increase up to $8,400 for somebody who's 64 years of age, earning $15,000 a year. So they earn $15,000 a year, and their premiums could go up by more than half of what they're making. Now, to put that in perspective, again, a comparison of who wins and loses under this plan. If you're 64 earning $15,000 a year, you pay more, $8,400 more. If you're 65 years of age and earning over $3.5 million a year, you put $200,000 more back in your pocket. This is a ripoff for the majority of Americans and should not see the light of day. Take both of those. So, on top of that, Trump Care creates Medicaid vouchers. We've been talking with colleagues about the change in Medicaid. What does that mean? Well, instead of being a health care plan that covers nursing home care, whether that is someone who needs very little care or someone who has Alzheimer's or other extensive needs, your mom and dad or grandpa and grandma would get a voucher. And if it didn't cover the care in the nursing home, as it does now, then your family would have to figure out a way to make up the difference. And we could have very possibly the situation we had before the passage of the Affordable Care Act, where a lot of folks were going bankrupt, trying to figure out, you use the equity in your home, except because of what happened with the financial crisis, you may not have much equity in your home anymore. And so you're trying to figure out, how do I make up the difference to help my mom or dad or grandpa and grandma in their nursing home? Very common discussion, I would guess, if this passes. So turning Medicaid into a voucher system would cut nursing home care and health care for families. And let me also say that when there's a healthcare emergency, like we had in Flint, Michigan, with 100,000 people being poisoned with lead, over 9,000 children under the age of 6 with extensive lead poisoning, when we had the president and the administration, the past administration, step in to help those children because of the health problems with lead exposure, that would not be possible under this new regime. It would not be possible to step in when there was a healthcare emergency for children or for a community. In Michigan today, 150,000 seniors depend on healthcare through Medicaid for long-term care. 3 out of 5 seniors in nursing homes in my state. 3 out of every 5 seniors count on Medicaid for their long-term care. This radically changes and dismantles that healthcare system. We have nearly 1.2 million children in Michigan, 380,000 people with disabilities that use this system. So we have a situation where we would see a radically different healthcare system for seniors, additional costs for seniors, which is why the AARP is calling this the senior tax. We would see children losing their health care. We would see insurance companies being put back in charge for decisions about whether or not women can get basic care, what, if any kind of pre-existing condition coverage happens. What I have seen is something that doesn't work. It's going to put more costs back onto families. Mental health care, the ability to make sure that if you have a health care challenge, cancer, or some other kind of challenge, that your doctor is going to be able to treat you and give you all the care you need, not just a lump sum that the insurance company has decided that they're willing to spend. Accountability as it relates to how much of your healthcare dollar that you spend goes into your medical care. A whole range of things that have been put in place so that you have more confidence that at least you're getting what you're paying for. And those things go away, and insurance companies are put back in charge. They're given a big tax cut. The insurance company execs are given an opportunity for big increases in their pay, while everybody else is paying more. So let me go back to where I started, Mr. President. Trump Care, the bill being voted on in the House, is really a triple whammy for the people of Michigan. Higher costs, less coverage, and more taxes. It makes no sense. And I will strongly oppose it when it comes to the Senate, and am hopeful that we can put this aside, stop all of the politics around repeal, and have a thoughtful discussion about how we can work together to bring down costs and to be able to address concerns to make healthcare better, not take it away. Thank you, Mr. President.